Wheeze is a very common complaint in childhood. In fact, though, wheeze is a symptom and not a diagnosis. A very common cause of wheeze is asthma, but it is not the only cause.
Who tends to suffer with wheeze?
We can wheeze at any age, but children are quite commonly affected. Up to about 10 to 15% of children will have asthma, and many other children will wheeze in response to viral infections.
When does it tend to happen?
Well, having a recent cold, a number of children, particularly in the first year or two of life, will then become wheezy a bit later in the illness. Children who have asthma may have many different sort of precipitants of their wheeze, whether it could be an allergy, such as house dust mite, or viral infections.
Does this mean my child will develop asthma?
Well, asthma, as a strict diagnosis, is where a child has allergies, a tendency to have eczema, and a family history. If there's none of those and the child is much younger, we often say it's just viral-induced wheeze.
What tends to make it worse, and what should my child avoid?
Well, we know that cigarette smoke is a great irritant to the lungs, and that can worsen a lot of wheezing conditions, indeed asthma. We know that children who have parents who smoke in the home are much more likely to be admitted with respiratory infections and wheeze.
Should I seek medical attention if I think my child is wheezing?
Well, children may be breathing very normally with wheeze, or they may become very unwell and breathing very fast and looking very distressed. If your child is looking very breathless, then they will need urgent medical attention.
Will my child ever grow out of wheezing?
Well, about 15% of children may have a diagnosis of asthma, and most of those will grow out of it later on in life, often before puberty and certainly before adulthood. Children who have wheeze in the first couple of years of life in response to viruses and when their airways are quite small will not have this when they're older.